Hello viewers, I am Dr. Shrikant, pediatric gastroenterologist. In today's we will see what are the problems with cow's milk, and one of the important area in that is cow's milk protein allergy. So milk is a nutritious food, and it is given more so for children like young infants and children, but it can cause many problems. So we are all aware of something called lactose intolerance, where there will be problem with the lactose component of the milk. So before going to the components, let us see what are the different components are there in the milk which can create problem. So one is lactose, which is a milk sugar, which uh, which has to be digested, broken down in the intestine, and then it can be absorbed. So lactose is broken down into glucose and galactose, and only those things can be absorbed across the intestine. If there is any problem in digesting this in the intestine, there can be some symptoms. So this usually happens in older children and adults, because the nature has given us the gift of having a adequate enzyme when we are young, so that we can digest milk. So this is something related to the lactose intolerance. So the other important component is milk protein. So we all know that milk is nutritious, it has a lot of healthy protein, and people take it as a source of protein. So but this protein can create problem. So milk protein, and there are a couple of different types of protein. So when there is any problem with that, then we call it as allergy related to that protein. So this can happen. So there are 2 3 different types of milk protein allergy. One is something like acute or sudden onset, and the other thing is delayed kind of allergy. So today the intestinal manifestations are acute, are delayed ones, while the lung manifestation and skin manifestation, that is rash and all those things, are acute ones. So in this video we will discuss on the delayed onset ones, which has mainly intestinal symptoms. So a couple of key features: this develops only in young infants who are less than 6 months, who are given with cow milk based products. I'll tell you how all the cow milk can reach these young infants. One is if the mother is taking dairy products, cow milk products, either milk, curd, ghee, butter, or any food item contain these things, then through mother's breast milk, that can reach the baby. So this is one way how the baby receives the milk protein. The other option is the way is through the formula. The normal formulas which are given for babies are cow milk based. So the routine formulas, if the baby is not able to, if there is no milk output, and if the formula is given, then it is cow milk. It contains cow milk based this thing. So these are the two ways. Or if the cow milk is directly given to babies, so in some communities they do practice, like after 3 4 months they directly start cow's milk. So these are the ways through which cow's milk protein is entering the human body, the baby's body, and in some individuals it can create problems. So let us see what are those problems. So main problem is there can be blood in stools. The poops or the motion can have few drops or even sometimes more blood. So this is one of the key symptom what we see. There are couple of other reasons why there can be blood in the motion, but this is one of the important ones. Based on the symptoms and other factors we can identify. If you visit your pediatrician or pediatric gastroenterologist, based on the symptoms, the pattern of involvement, they can identify what exactly it is, and based on that the treatment can be initiated. Unfortunately, there is no simple test to prove this. It is all based on the temporal correlation with the symptoms, uh, and based on the history, the complaints which you tell. So the doctors will be able to diagnose it, and the only treatment is to avoid that allergen. That means here we have to avoid the cow dairy products. The crux is, in case of lactose intolerance, the lactose is predominantly present only in the milk, not in other dairy products. So only stopping lactose should be okay. But here, in case of cow's milk protein allergy, you need to stop all dairy products, because proteins are present in all dairy products. That has to be stopped. So there should not be any confusion between these two things. So because normally when we hear about milk protein allergy, So there is always a confusion with lactose intolerance, which is entirely different, and this is different, and even the treatment line is also slightly different.